Part 2.
As the months pressed on, the odor dissipated, but by that time, we felt lucky there was an odor, and at least we knew we were being exposed. It is what we didn't smell that truly frightened us now. We remained fearful of what was in our soil and water because the EPD did not then, nor have they now, performed any testing of our home wells or soil to see if we were truly safe. We began to take this task on ourselves because our children were still not well. They had various symptoms such as blood in their urine and strange rashes. Our community task force began to approach testing laboratories throughout our state, but none would agree to do the testing due to fear of backlash by the EPD. For doing so, it would cut out their government business income in the future. Finally, we were truly blessed on December 22nd, 2006, when the Fulton County Commission saw to it not to renew the Fulton County permit with PSC, which has given us at least partial protection. However, the state continues their permit to this day and continues to validate the poisoning of their residents. In fact, there is no known record of any corporation being permanently shut down by the state due to the poisoning of a Georgia community. The state of Georgia doesn't even recognize pesticides as a toxic waste, and therefore all other states that do recognize this fact are happy to send their toxic pesticides to be dumped in Georgia in mass quantities. Such in this incident where their shipments came from Alabama by the tanker carloads. The truth plainly is that if we as a community really mattered to our state, this corporation would no longer be operational and our safety would be assured. But what appears to matter more is the bureaucracy of government that was so well illustrated in Hurricane Katrina. It appears that our government has grown very comfortable in waiting for someone else to do something rather than being one that is willing to take the risk of quick and decisive action to protect the citizens they have been charged to serve. Our prayer is that today this committee would be bold as to take quick and decisive action to protect our community. Shut this plant totally down and begin to use the $8.8 million increase in the state budget for hazardous cleanup and bring our community back to one of wholeness. We further request the appropriate funding and staffing of the EPD, along with laws that truly give them the authority to protect Georgia. Their status as of now is a permitting and fining agency only. We must have laws that no longer allow Georgia to be a toxic dumping ground for this nation, and laws that truly allow the EPD to carry out enforcement. We also request that the State Division of Health be given the appropriate training and the financial capability to handle chemical exposure of its citizens. We understand that there is a syndromic surveillance system in place in the state of Georgia, but there was no triggering method for its use in our community. We, as citizens, are very concerned that chemical warfare could easily be used in a terrorist attack in the state of Georgia. In fact, this very organophosphate that we were exposed to was developed as a chemical warfare agent in World War II, and we are lucky to be sitting here today. That being said, if you look around this room today, you will see a lady in a wheelchair who can no longer talk and has limited lung capacity due to her exposure. But she felt it vital to be here today. Our community has truly suffered and continues to suffer. We need your leadership and your activism to put a stop to this because we know we must matter somewhere. Thank you for your willingness to hear our story. We know you can help us to truly make a difference. In the packets before you, you will find our Community Task Force rebuttal to the Georgia Division Health Report. You will also find a CD with 3 PowerPoint presentations. One educates you on the chemical which our community was exposed to. The second PowerPoint is an independent study done by Dr. Glickman and Purdue University and their surveillance that was conducted of pet hospitals in our area, showing significant increase in pet illness and death during the months of our exposure. And finally, we have included a PowerPoint that was given by the Georgia Division of Health in 2007 on their syndromic surveillance system that is totally lacking the key trigger of pet exposure as the first sign of bioterrorism, and the lack of protocol for community investigation. And finally, one beautiful thing that happened to note, out of this whole event, you have witnessed a Georgia community come together that has exemplified the biblical scripture, love your neighbor as yourself. I would ask this community to please stand. Whoever's here. Whoever's here from our community, please stand. Among this community are people who have dedicated their energy to research all there is to know about this incident, as well as find loopholes in government practices. And I would ask you not to reinvent the wheel as you proceed in making the necessary changes in policy. Use this community of experts who have come together to form a panel that would assist you as you move forward. Thank you again for allowing your citizens to take part in this critical discussion, and I'm honored to have been given the opportunity to represent such an exemplary community.
Thank you, Ms. B. Miller. We appreciate you being here today, and we appreciate the information. We appreciate all you folks coming down and all you've done too. I've obviously met a lot of you at the town hall meetings and appreciate you being here today. And thank you for the packet of information. It's quite impressive, actually. We appreciate you doing that. Senator Carter.
Yeah, just very briefly, Mr. Chairman, thank you, Ms. Big Miller, for your testimony, for the hard work, obviously, that you put in on this effort. I don't have any questions for you, but Mr. Chairman, I would ask that the minutes reflect that immediately following their presentation and before the citizens had an opportunity to present their side of the story, and before we heard from the emergency coordinator there locally, and before we heard the concluding comments of Representative Flood, that those here on behalf of the EPD left and we're not here to consider what was said. I think that says an awful lot.
Thank you.
Minister.
Yes, it does.
I concur. Duly noted. Anyone else have any comments or questions for Ms. B. Miller? Thank you again.
More hearings to come, January 2008.